Good morning. One of the privileges of doing this show is that I have the time to do some research or to do things in my own life that many of you don't have the time to do. Okay? Uh, Recently, I've been on this little adventure with the doctor's office and medical billing, which I've learned a lot, but it is a full time job, my friends. It's a full time job. Many of you out there probably have medical bills right now, or you're receiving medical bills for something that you had done recently. How many of you just pay them? How many of you have gotten something called an EOB? Do you know what that is? It's an explanation of benefits that your insurance company sends you after you have a doctor's visit or a procedure, and it explains to you what the provider billed, what they're going to pay, and what your portion, what you're going to owe your provider. It's a very important document. And sadly, many people don't even open them. Or they open them and just, yeah, whatever, I'm going to have to pay bills. My mother, God rest her soul, would never question a bill, especially a medical bill. She would just pay it. Well, my friends, today in 2019, you need to question everything. And I do. But I am going to warn you. It's a full-time job. On January 11th, I received a medical bill that I believed was incorrect because it was for an annual exam. Remember the Affordable Care Act? Whatever you think of it, it is still the law of the land. And the Affordable Care Act says, at least the portions that we were told about from the politicians who wanted it made into law, that you get an annual exam and an annual pap smear if you're a woman, and an annual mammogram if you're over 40 and you're a woman, at no charge. No out-of-pocket charge. Of course, you pay for your insurance premiums, but the insurance is supposed to cover it. But see, like everything that sounds too good to be true, well, this one kind of is too. Because there's loopholes in the Affordable Care Act. And it took me about 45 minutes of researching to find them. And believe you me, your medical provider knows about them and is taking full advantage of these loopholes. The title of today's show is The Meter is Running. Now that may sound weird to you. What does that mean? Well, what it means literally is the meter is running. I called the doctor's office on January 11th and said, I am disputing this bill. This was part of an annual well visit. I should be paying nothing for this office visit. And the answer, which I guess people talk to me because she said something she probably shouldn't have said, and she realized it really quickly. But people talk to me. Maybe it's my positive, sunny demeanor. Who knows? I'm so nice and positive and sweet. And actually, when I'm talking to a medical provider or an insurance company, I do put on the honey. I do the honey, not the vinegar, at least at first. At first. And again, this will be a series of shows, so it gets a little better, a little bit more dramatic. But in this case, I was being really sweet, and what she said to me was, well, if the doctor went over the allotted time for the appointment, then you need to pay extra. You would need to be charged for an office visit. And I said, what did you just say? Oh, she said, I shouldn't have said that. And then she started backpedaling a little bit. But you know what the problem is? Political Paula kicked in. You did say it, sweetheart, and I'm not going to forget it. So here I am telling all you about it, because you should know about it. Because many of us have doctors that we've known for a long time. There are family doctors. Some of you have probably had the same family doctor for decades. So you may go in, and when the doctor walks in the room, hey, how's the family? How's the grandchildren? Look at this weather we're having. Don't do that. Please don't do that anymore, because see, the meter is running. The meter's running. What these medical providers, some of them, okay, I don't know about all of them. You might be lucky and have a doctor that treats you like you're the only patient he has that day, and never charges you extra for it. But again, with everything that's been going on in healthcare recently, some doctors refusing to take Medicare patients because they're not making their money. Doctors have an expected amount of money they want to make every year. And if you look at your explanation of benefits, you will see that a doctor may bill $250, okay, for a well visit. The insurance will only pay maybe half of that. And because of the Affordable Care Act, they can't bill you for it. So doctors are billing up here. They're getting paid by insurance down here. So if there is a chance that they can even that scale up, that they get closer to this with the money they earn than to this with the Affordable Care Act, they're going to do that. Not all of them. Please, don't put your thumbs out saying I hate doctors. That's not the truth. There's some really good doctors out there who really don't care about making a fortune. But there are others who basically want to see as many patients in one day as they possibly can. And I'm going to talk about that in another show, about the reasons for this, which I have a theory. It's not confirmed, but I have a theory about it. And it's because many of these doctors are now owned by medical insurance companies. And their salary is based on their productivity, which means how many people they can get into the office in a certain day. And this is why I'm telling you the meter's running. So don't waste time. The minute the doctor walks in the room, don't waste time. How are you? How's the family? Lo, isn't this weather horrible? Or isn't this weather beautiful? No, get right down to business. Let's talk about my health, doctor. That's why I'm here. If the doctor is a chatty Cathy, starts asking about your family, your job, say, no, wait. Let's talk about my lab results from my blood work I got done and check my vitals. Let's get to business. Get right down to business. It's kind of like you take a taxi to the grocery store and the grocer, and the grocer is like talking up and, no, taxi, meter's running. I got to go. Just give me my damn vegetables and I'm out the door. You got to watch that. Because whatever time is allotted for your medical visit, you go over that. It can be the difference. Let me tell you this. It can be an extra billing to your insurance company between $150 and $200. Okay? A medical exam will be covered. If it's labeled medical exam under the Affordable Care Act once a year, that will be covered 100%. But an office visit, if the doctor chooses to code, we'll talk about coding, for an office visit on top of the medical visit, you will be responsible for a portion of that office visit, even with the Affordable Care Act. And the doctor knows this. The insurance company knows it. The only person who doesn't know it is us, the client, the customer. We talked about customer service on Thursday, remember? We're the ones who don't know. And try to ask. And let me just tell you something about this. If you ask your medical provider, well, how much is this? The medical provider says, oh, you're coming in for your physical. We're going to do lab work, blood work, okay? And so you think, oh, yeah, that's part of the physical. It's covered under the Affordable Care Act. Well, no, actually, it's not. Not all of it. And you would maybe ask the doctor, well, how much is this going to cost? And the doctor will say, oh, I don't know. You'd have to discuss it with billing. Well, bullshit. The doctor does know. The doctor may not know the amount, the actual dollar amount, but the doctor knows when they write a code in, which is all the insurance companies get blamed for everything. Every bill you get, oh, stupid insurance company. Well, see, no, because you call your insurance company, you take the time to do that, and they will tell you, well, you have to go back to the doctor and talk to them because we're going by the codes. We don't know why you went to the doctor. We don't even know what the diagnosis was. We just know that we got a billing information from the doctor with codes. And those codes determine whether or not you have out-of-pocket expense. Okay? So if the doctor knows that he has 15 minutes with you and he sees you for 20 minutes, maybe he could say, well, we've gone a little over our time allotment, so you may get a bill for a portion of this visit. Of course, they're not going to tell you that, but they should, and they should have to. If you call a contractor to come into your house to paint your kitchen, are you not going to ask for a price before you let them start painting? And they will give you a price. And it's in writing. It's a contract. So they can't come back and say, well, we charged you $100 in the contract, but we actually had to buy another. Some contractors may try to get away with it, but once you have that contract, that's what you pay. And that's exactly what happened to us with our electric. It was $6,000. They didn't say it was $6,000 unless they were here an extra hour. And they definitely didn't say it would be less if they were here less than the time they thought they were going to be here. It was $6,000. There is a plan out there. Some people are saying that when you go to your doctor's office, when you actually schedule your appointment, or you're going into the hospital for a procedure, that you should be allowed to ask, how much is this going to cost me out of pocket? How much are you going to bill my insurance for? And then you can call your insurance and ask, how much of this is going to be covered under my plan? It's a lot of work, but it's worth it. This is your financial health we're talking about here. And we all know how expensive medical care is in America. America has the most expensive medical care bills. Doctors here charge more than any other medical provider anywhere else in the world. Our doctors make more money and they charge more money, as well as our hospitals, our surgeons. They're more expensive. It's the way America rolls. It's all about the almighty dollar. And yet Americans are less healthy than many of our counterparts in other developed countries and in some underdeveloped. That's something to think about, isn't it? So remember, even go ahead and ask next time you walk into the doctor walks in, am I on a time clock? How much time do you have to talk to me before you start charging me extra? Because the meter's always running. Let's talk about the loopholes in the Affordable Care Act, because again, your medical provider may say, well, you need blood work as part of your annual physical, and some blood work is covered by the Affordable Care Act, but only in certain situations. Here's what's always covered once a year at no cost to you out of pocket. A lipid test, that tests your cholesterol. That's covered. No questions asked. It's covered. But a hemoglobin test, which tests for a lot of things that are important to your health, one of which is A1C, which is diabetes, is not always covered. And here's what I found out in my research from the Affordable Care Act, that in order to have your A1C hemoglobin blood test covered at 100%, you have to be overweight, according to the medical community. You have to have high blood pressure, or you have to be at risk for diabetes. Now, with 8 million Americans suffering from diabetes right now, don't you think everybody's kind of at risk in some form or fashion? I mean, I'm thin, right? I'm a thin person. And I don't have high blood pressure. And yet I do have a family history of diabetes. My grandmother had diabetes. My mother did not, but my grandmother and all of her sisters and brothers had diabetes. So it does run in my family. But that's not necessarily enough. Now, if you have a high A1C at a previous appointment, you could be considered at risk. But again, the doctor has to code it that way. And if the doctor doesn't, then they will not cover this hemoglobin test, which I would think should be part of any annual physical. because there's people at all ages that get, and all sizes, that get diagnosed with diabetes every single day. But it's not always covered. And if you don't want to pay a portion of that hemoglobin test, you need to tell your doctor before they draw the blood. Okay? This brings me to my next point. The drawing of the blood. You know, the nurse comes in and takes the needle and takes out like what feels like half your blood. That might not be covered either under the Affordable Care Act. It's kind of like the vaccines. They'll cover the vaccine, but they won't cover the $15 the doctor's office charges to actually stick the needle in your arm, which I think is absolutely ridiculous, but it's very, very true. Coding. It's all about the coding. Now, what does the Affordable Care Act actually do? Well, here's what it definitely covers, because it says medical exam. Well, here is what a medical exam is, my friends. And this, again, I'm not telling any of you not to go to the doctor. But if you want a no cost to you exam, well, you can do it at home or at your local drugstore, your pharmacy. I'm telling you the truth. Here's what a medical exam covers. Your height, your weight. They take your height, they weigh you at the doctor's office. They take your blood pressure. And then the doctor feels around and checks your ears, checks up your nose, checks your reflexes. That's covered. Now think about what I just said. Okay, how many of you have a scale in your bathroom? Most of you do. So you can weigh yourself in your own bathroom. And when you weigh yourself naked, by the way, you lose 5 pounds than when you're at the doctor. So you'll feel better if you weigh yourself at home. Doctor scales are always 5 pounds more. You can probably measure yourself at home too, your height. And really, do you care how tall you are? I don't care. I just know I'm short. I don't need a doctor to tell me that, or an insurance company to pay for a doctor to tell me that. Blood pressure. You can get a blood pressure machine in your own home. My cousin has one. Or you can just walk into any pharmacy and they have a free blood pressure machine. You sit down, you put your arm in, you push a couple buttons, it tells you your blood pressure. No cost, no office visit, no nothing. Let's talk about blood tests. You can actually test your blood sugar at home, whether it's prescribed by a doctor or not. My friends, you can buy something called a glucometer, which is the blood testing kit. And you can test your blood sugar every morning and 2 hours every night after you eat, just like they would tell a diabetic to do. And you can keep track of your own blood sugar in your own home without an insurance company telling you it's not covered, and without going to the doctor. You can get them on Amazon. You can get them at the Walmart. They're about $30. So you can do a lot of these things at home without worrying about the explanation of the benefits and that you're taking up too much of the doctor's precious time. Here's what pisses me off, and here's the lesson for today. You see these commercials. Go, no, save your life. It's all these actors coming on TV trying to encourage you to go for an annual checkup. And then there's even some public service announcements that say if you're having a problem, when you go to your doctor for your annual checkup, tell them. Tell them if there's an ache or pain or a lump that you didn't have before, or you're feeling depressed, or, anything, you need to talk to your doctor. Even the doctor should say to you, is there anything you'd like to discuss during this visit? But the meter's running. And sometimes if you mention something that's going on, just mention it, and the doctor looks at it. I have a cyst on my neck. If I'm in a well visit and I say, look at this cyst, doctor, it can turn into an ill visit simply because I mentioned a problem. Is that fair? Isn't that what an annual exam is for? To annually go over things that have happened during the last year that involves your health, your body, changes in your body. I'm going to give you an example. I went for a pap smear a couple of years ago. And during the pap smear, my OBGYN happened to discover, I didn't know I had it, a minor yeast infection. And he said, I think you've got a yeast infection. He swabbed it, tested it. It came back positive for a yeast infection. He wrote me a prescription. I took one pill, yeast infection gone. 2 weeks later, I got an EOB. And I was being charged $200 and some. I was being charged for the entire visit because the doctor's office miscoded the visit as an ill visit. Like I had gone there not for my annual exam, but because I had a yeast infection I didn't even know I had. So I called the doctor's office. And unlike the doctor's office I'm dealing with right now, who is taken over a week now, I still don't have an answer to my billing question that started on January 11th because they're just too busy to call me back. The customer. But my OBGYN, I got right through to billing. They said, oh my gosh, no, we coded that wrong. They recoded it. A week later, I got the EOB. I owed nothing. I didn't even have to pay for the yeast infection test, which technically I could have had to, but I didn't. They didn't even charge me for that. They recoded the whole visit as an annual Affordable Care Act covered visit. That's the way it should work, by the way. Right now, I'm still kind of in this, as of the recording of this show, I still don't have an answer to the billing questions that I submitted to the doctor on January 11th. We even sent, last Wednesday, we sent a copy of the EOB to the doctor's office, to the nurse. No response, because they're so busy. But I'll let you know. Now, what your doctors know, this is a quick story that really, really brings home the fact that not all doctors will tell you what you actually should know. And that is about the Affordable Care Act. It's my mother-in-law's story. It's very important, so please, I know it's a little long today, the show, but please keep listening. My mother and father-in-law were self-employed most of their lives, so they had self-insurance. They had expensive insurance, and it didn't cover much. And so when she would go for her mammogram, my father-in-law would tell the provider, we're going to pay cash because it's cheaper than submitting it to the insurance company because they're not going to cover it anyway. So in 2015, well after the Affordable Care Act for Women was active, was the law, my mother-in-law went for her mammogram. And my father-in-law, not knowing about the Affordable Care Act for Women, that his wife was entitled to a mammogram at no cost, he said to the provider, well, what's the cost for, I'm paying you cash. Now that provider knew damn well right that first of all, my in-laws had health insurance. And at that point, they should have been told by the provider that, well, there is no cost if you go through your insurance. They didn't tell them that. They just took their $200. And we had dinner with my in-laws shortly after that. And I said, what do you mean? You paid $200 for a mammogram? Out of your pocket? I said, no, that's illegal. I said, Mom, you call them tomorrow and you get your money back. And you say Affordable Care Act. And she did. And she got her money back. Now, I know this is time-consuming stuff. Many of you with full-time jobs cannot have your phone attached to your hip like I have had for the last 10 days now, waiting for a phone call from the doctor. And remember, the doctors aren't thinking about you 24/7 like you're waking up when you're expecting a call from the doctor, right? That's all you think about. You're afraid to take a shower. I was afraid to take a shower. Oh, God, I'll miss the call. And if you miss the call, they're not going to take your call when you call back. They're going to be busy doing something else. Because they're not thinking about you. They're going home to their families, having a nice dinner. They don't think about you or me. The squeaky door gets oiled. So sometimes you have to keep calling. And again, who has time for that shit? I submit to you that I hope that this bill passes that's saying that you can ask in advance what your financial responsibility will be for any doctor visit, blood work, any medical procedure at all. When I go to the dentist and he says I need a crown, he gives me paperwork that tells me what the crown is going to cost before he even touches my tooth. And I have to agree to that. And he also tells me what my dental insurance will cover. I have a dental discount plan called Carrington. It's excellent. Maybe they'll want to sponsor my show so I can get a little paycheck for doing this every day for you guys. All the hard work I put in. Yeah, Carrington Care, if your dentist accepts it, and not all do, it's cheap. My husband and I, for both of us, pay $130 a year. And what it does is every dental procedure you have is cut in half. It has saved us thousands of dollars since we've started using it. It's really good. So again, I go to the dentist. He says, you need a crown. Here's what it's going to cost. Here's the discount from Carrington. And now I do have dental insurance. So if that's what the dental insurance will cover, this is your cost the day I do the job. I know in advance. That's how all medical practitioners should work. All medical procedures, doctor's visits, you should know before you go. Know before you go. And remember, you're on the meter, so don't chitty-chatty. You and your doctor can discuss the weather some other time. It's not a social call. It's your health. And that is what, and all, by the way, that is all that should be discussed during the short amount of time your doctor has allotted for you, where it won't financially harm you. Yeah, first do no harm. That's the Hippocratic Oath the doctors take when they graduate medical school. And it used to mean physical harm. First do no harm. Now I kind of think they should change it for the new medical school grads. First, do no harm physically. Second, do no harm financially. Don't screw somebody over because you need to see a certain amount of patients or you need a certain amount of income to support your lifestyle. These people trust you. They respect you. And you put them on the meter like they're in a taxi? Know before you go, and please question. Take the time, ask the questions. It could save you a lot of heartache financially, especially for those of you who have chronic conditions, who have a lot of medical bills. Question everything. Know before you go. And don't be afraid to question, and don't be afraid to say to the doctor, you know what? I don't care to talk to you about my job. I know I'm on the meter. Political Paula. Out.